We've seen more reports appearing recently of schools that are under financial pressure that could close in the Dublin area if funding isn't forthcoming quickly. And now, today, we have a story about a GP practice in a deprived area of Dublin, servicing a lot of patients that otherwise wouldn't have any access to medical attention. It could be going under because of taxation. The way that this practice is set up, it's set up as a not-for-profit organisation, but because of tax shenanigans, they face the pressure of going bust or not being able to pay their taxes because of double taxation. So we're going to have a look at this and see what implications this could have for the community in Dublin of which they are serving.
Is based in Summerhill in Dublin 1. It is an area of significant deprivation. We have many homeless patients, including a large number of homeless families. The average age of death for our patients is 60, and that's down to patients developing poor ill health at a younger age. So we see patients with conditions like heart disease, COPD, cancers in their 40s and 50s, where those things would develop in maybe people in their 70s and 80s and other.
It's worth noting here at the moment, notice the language coming out. We're seeing cancers in people in their 40s and 50s that we wouldn't normally see until they were in their 60s and 70s. We're seeing a large increase in the amount of heart diseases that are appearing among younger people. I wonder what could be causing that. And it's not just poverty and deprivation.
Populations. A lot of the resourcing for those conditions only kicks in when a patient hits 65, and we don't have that luxury. We don't get those additional resources because our patients develop these conditions at a younger age. So we have far higher complexity of patients, the patients have more need, but in other areas there is no additional funding for this. Whereas our charitable model, it means that all of the profits from the practice go back into the practice and helping improve the standard of care for the patients.
So here we're hearing a story that this business model is not working out in this poor and deprived area of Dublin. I think it's in Dublin 1. And the background to this is the actual reasoning behind this one is that 2,500 patients, so it's a big practice facing closure despite assurances by the government during the general election. And I believe Stephen Donnelly assured this practice in particular, you'll be fine. Once the election's over, this will all be taken care of. Well, obviously, that fake, empty misinformation, disinformation promise has not been kept. The charity GP Care for All opened in Summerhill. It's been going for 10 years now due to the large number of medical card holders in one area of most deprived and diverse parts of the capital. Diverse, I'm not sure exactly what they mean when they say diverse. Age range, demographic, income status, nationality possibly. You'll find out a little bit more about this later on in the article. The service says that as it operates as a charity, it's being taxed on the double, making the business unsustainable. So the issue relating to tax status is complicated, but it's become a distraction and a source of anxiety for her and her colleagues. And if it's not resolved by June, they're going to close the doors. And again, this mirrors a story for a school in Finglas that's due to close, I think, this month if it doesn't receive emergency government funding as well. Now we're talking about a not-for-profit GP practice going down as well. Doctors are employed by the charity. Before the change in law, most practices, what happened is income from the medical card contract would go to the practice paid the doctor, but now they're being charged twice, so they can't continue under this model despite government assurances that everything would be all right. And here we have one of the patients, local resident Terry Fagan, said it would be devastating for the community if the surgery was to close up. Dr. Shanahan said the needs in the area have grown over the decade. I wonder what could be causing the increase in needs over the last 10 years, given that we know homelessness has spiked crazy high over the last 10 years. Record number of homeless people in Ireland, most of them centred in and around Dublin. And listen to this, as have the challenges of providing services to those with a variety of complex needs in multiple languages. Okay, huge amount of strain being placed on medical services as it is, let alone thousands of people pouring in from other countries. So it's an area of significant deprivation. When we started in 2015, Gardner Street was mostly youth hostels and B&Bs. Well, we all know who's in the B&Bs and the youth hostels and the hotels now, don't we? All the government accommodation, or all that accommodation, is now dedicated to homelessness accommodation, mostly for families, so a large number of patients are living in homeless accommodation. Average age of death for our patients is 60, down to patients developing ill health at a younger age. Well, for sure, poverty is a massive contributory factor to ill health, both mental health deterioration and physical health deterioration. So if any area really needs access to medical services, it's this one, but the deck is not in their favour. Patients, cancers in their 40s and 50s, whereas these things would be developing in people in their 70s and 80s. Yeah, well, poverty certainly has an impact on that. But I'm trying to think, can anyone think of anything that's happened over the last few years that could cause a massive spike in heart disease and turbo cancers among a younger population? Well, you let me know what you think in the comments below. No for-profit GP practice would set up here. Such is the nature and conditions of those who need GP care in this community. In other words, they don't want to know. If it's a making money enterprise for doctors, they don't want to know. It's too messy. It's too complicated. Not enough in it. No for-profit GP practice would set up here, such as the nature and the conditions of those who need GP care. The Department of Finance, with its powers to step in, could do so to allow this medical charity to continue. It would be devastating to see this practice close up. It's unconscionable that the government of the day would allow this practice to fold. Well, unconscionable and government care aren't two words that really sit very well together. The government doesn't give a damn about the people in that area, so much so that this practice has been running for 10 years on a not-for-profit basis. And if it closes, tough for the people living in that area. They've said themselves no for-profit GP practice would consider opening there. What's it like in your area? The GP services have gone to the dogs here in Northern Ireland. It's crazy. If you want an appointment now, you have to get up. It's a scramble at 8 o'clock in the morning to phone the practice. You have to wait in a queue. You may or may not get spoken to by a receptionist. You're then triaged by a receptionist. Give all your private details to them. They decide whether or not it goes to the doctor or not. You might get a phone call later on that day. You might not. And if you do, then you're told to come in ASAP, which may or may not be convenient. You may not have access to transport. It's an absolute mess. It's a mess. What are your experiences with GP practices in Ireland? Good, bad or ugly? Let me know below. And is this potential closure of this surgery in Dublin one foretaste of things to come when it comes to health provision, especially in deprived areas? But for now, I'm Rick Munn, No Risk, No Reward Media, over and out.